The regulation of the heart. How do I regulate how my heart works? I basically have two things. I've got intrinsic and extrinsic regulations, okay? Intrinsic means I'm born with it, it's part of me. Extrinsic means it's some type of outside source, think exit. To maintain homeostasis, which is, what now? If you didn't say a set point suitable to support life, you better know that. It's the amount of blood pumped by the heart that must basically vary dramatically by what we're doing. If I'm going to Zumba, I can't have my heart beating like I'm teaching your class. If I'm teaching your class, I shouldn't have my heart beating like I'm going to Zumba. There needs to be balance. There needs to be homeostasis to that. Now, intrinsic regulation, again, born with it, it's part of me. It results from the normal functional characteristics of the heart. It doesn't depend on your nervous system, it doesn't depend on your endocrine system, which are outside systems. The extrinsic regulation, again, exit, something from outside. Now we're talking about your nervous system, neuronal, or hormones from your endocrine system. With neuronal, or the nervous system, we're talking about the sympathetic and parasympathetic. If we're talking hormonal, then most likely we're talking about the adrenal gland releasing epinephrine or norepinephrine from the adrenal medulla. So, intrinsic, inside of the system. As venous return increases, the end diastolic volume increases. The greater that volume, the greater the stretch on the ventricular walls. What does that mean? The greater the preload, the more my ventricles stretch, the rubber band. Cardiac muscle exhibits a length versus tension relationship, meaning the longer it gets, the more power it bounces back with, just like the rubber band I talked about. Venous return is the amount of blood returning to your heart at the end of each cardiac cycle. Now, we just talked about Starling's law of the heart. Increased preload causes cardiac muscle fibers to contract with greater force and produce a greater stroke volume. In other words, when I fill it with more volume, when I fill the heart with more volume, and those ventricles are stretched further, the rubber band, it causes it to bounce back with a lot more force, okay? So it creates greater force, which means that you create greater stroke volume because the harder it's bouncing back, the more volume is moving per beat. Afterload is the pressure the contracting ventricles actually have to overcome to move the blood. So I actually have to consider that, how do I put it? Think about going to the gym and I'm trying to lift something. There's kind of that part of lifting where you get to a point where you're like, oh, I can't do it. But once you get past that point, it gets a lot easier. That's kind of what afterload is talking about. The pressure, the contracting ventricles actually have to kind of, oh, it's so hard. Okay, and then finally I get to go. I hope that makes sense. It's a lot easier if you can see me, and I'm sorry. Okay, extrinsic regulation. Again, now we're talking nervous system control or endocrine system control. The cardioregulatory center is a part of your medulla oblongata in your brain that regulates the sympathetic and parasympathetic control of the heart. We already know that parasympathetic is going to slow everything down, right? So it's actually supplied by the vagus nerve, and you've got the postganglionic neurons releasing acetylcholine. That actually causes the cells to become more negative than they would be at resting membrane potential. It hyperpolarizes them, and it slows down the action potentials. By doing that, you're decreasing the heart's rate. You're actually making it slow down. In the sympathetic part of this is actually supplied by the cardiac nerves. Now we're talking about releasing norepinephrine. Hello epinephrine, hello adrenaline. It increases the membrane permeability to sodium and calcium, meaning that it's depolarizing or causing the cell to fire, speeding up the action potentials. That's going to increase your heart rate and your contraction. Now, with hormonal control, specifically we're talking about the adrenal medulla releasing epi and norepi. So epinephrine and norepinephrine. We're talking about releasing adrenaline. Compared to our sympathetic nervous system, this is going to last a lot longer just because of the sheer amount of epi and norepi that your adrenal gland is releasing. Just like what we saw though in the sympathetic nervous system, this is going to increase the rate and force of that cardiac muscle's contraction. Okay, the heart and homeostasis. The effect of blood pressure, the effect of pH, carbon dioxide and oxygen, the effect of extracellular ion concentration. Remember that potassium, sodium, and calcium play a big role in how these muscles are working, how these cells are working, and the effect of body temperature. So, the heart and homeostasis. The pumping efficiency of the heart plays an important role in the maintenance of homeostasis. If your heart isn't pumping enough to keep up with what you're doing, whether that be I'm walking across a room, or I'm in Zumba class, or I'm sitting watching TV, it's going to actually affect how you're living. Blood pressure is the systemic circulation, meaning it's the one going out to your body, and it has to be maintained at a high enough level basically to achieve any exchange that has to occur, whether that's oxygen being dropped off or nutrients being dropped off. Remember that all of those things move via diffusion, and if we're talking about things moving via diffusion, it has to have that high to low movement. The conditions of metabolic activity actually may change thanks to things like exercise or rest. Again, my heart beats very, very differently when I'm in Zumba class versus when I'm teaching your class. So, the effects of blood pressure. I'm over here, by the way. The baroreceptors are those that monitor blood pressure. Receptor, it's monitoring something. Baroreceptors are responsible basically for monitoring your blood pressure through the stretch of your arteries, okay? If they detect a decrease in blood pressure, they actually will increase your sympathetic nervous system stimulation because it speeds up your heart. If my blood pressure is dropping too low, I do need to increase what my heart is doing. So by causing my sympathetic nervous system to activate, I'm going to increase how fast my heart is going and the force of contraction that it's having to kind of get me back into that homeostatic level. Now, looking at extracellular ion concentration, it pretty much is going to be guided by extracellular potassium. The more potassium I have outside of my cell, the slower my heart goes, okay? Increasing in extracellular calcium actually also increases the contraction and decreases the heart rate. Decreased calcium has the opposite effects. Now, body temperature, the effects of body temperature down here. Okay, so you increase your body temperature, you increase your heart rate. Pretty straightforward, actually. You increase the temperature of any chemical reaction, it goes faster. Whereas you decrease the body temperature, it decreases the heart rate. One of the things that is debated quite a bit, but has pretty much been decided, when people fall into things like, frozen lakes and they don't find them for 45 minutes, it's not unheard of for them to be able to revive that person. And one of the reasons they believe that happens is because their body temperature drops so much that all of the chemical reactions in the body slow down, including the heart rate, to the point that the chemical reactions happening in the body are so slow they don't need oxygen that quickly. So that's kind of an interesting side note. These are figures inside of your book. I think yours are a bit fancier than this, but it's a really easy way to see where things go to get you back into homeostasis. So this is my homeostatic line, this black line right here. This is perfection. This is wonderful. Everything's happy. This is like absolute utopia. The window, which is kind of this darker blue area, I can be away from this line as long as I'm in this window. As long as I'm in the window, I'm in the clear, I'm okay. It's not perfect, but I can live with it and my body will still run. Danger comes when I get out of this window, when I'm either below this window down here or I'm above this window up here. In this particular scenario that is on this slide, you can see blood pressure is what we're talking about. Here's perfection. Here's my homeostatic window where I can live with it and it's not going to hurt me. Problem is when I go out. So let's say that my blood pressure gets too high. It's way too high. Okay, so I'm out of that window. I'm out of that dark blue window. The baroreceptors, remember I told you those are blood pressure receptors, detect an increase in blood pressure, and they cause something called the baroreceptor reflex. Basically, the cardioregulatory center in your medulla oblongata will cause parasympathetic stimulation to increase, and it decreases sympathetic. Now, parasympathetic, that's rest and digest. What's going to happen to your heart if I'm in rest and digest? Is it going to speed up or is it going to slow down? Well, if I'm in rest and digest, it should slow down. What caused this? I'm too high. So by increasing parasympathetic stimulation here, the heart rate and stroke volume goes down. By doing that, by calming my heart down, my heart rate decreases, my stroke volume decreases, my blood pressure should come back into my window and keep me happy, healthy, and whole. If your blood pressure keeps going up and it goes up too high, it can actually cause you to have an aneurysm, basically meaning you're putting so much pressure on the blood vessel that they eventually rupture. Now, let's talk about what happens when it drops too low instead. So instead of going too high, now we're going too low. Baroreceptors are just pressure receptors, so they detect a decrease in that blood pressure and basically report it. Still the medulla oblongata in the cardioregulatory center, it'll start to decrease parasympathetic and increase sympathetic. Sympathetic is fight or flight. What's going to happen to your heart in fight or flight? And remember what started this. In this case, my blood pressure is too low, right? It's too low. So in this case, I need to decrease parasympathetic and increase sympathetic, fight or flight. The other thing that this does is it goes to the adrenal medulla. Okay? The adrenal medulla, again, due to sympathetic stimulation, starts to release epi and norepi. If I'm releasing adrenaline into the bloodstream, what's going to happen to my heart? So, epi and norepi levels go up. It causes the heart rate and stroke volume to increase. Sympathetic stimulation goes up, meaning my heart rate and my stroke volume increase. That, in turn, increases my blood pressure, which means that I go back up into my homeostatic window. Now, chemoreceptors, chemical receptors. They monitor your pH, your CO2, and your oxygen. Now, I'm not going to lie, this looks really, really complicated, and it is the way my brain works. But if you look at this, it makes a lot more sense. In this case, okay, now we're talking about the blood's pH. We're not talking about the blood pressure anymore, but the same principles apply. You still have that perfect homeostasis, that's the black line, and the dark blue that is the window where you can live with it, and you know it's not perfect, but it's still okay. However, you do have the capacity to go over that window or under that window. So over that window, okay? The blood pH increases. It's often caused by a decrease in blood CO2 levels, basically meaning that you don't have enough carbon dioxide, which, believe it or not, we actually do need. So, the chemoreceptor reflex goes to the medulla oblongata, and an increase in your blood pH, basically you're going too basic. You've got too much alkalinity in your blood, okay? Goes to the cardioregulatory center, and it increases parasympathetic and decreases sympathetic. Now, think about this for a second. I don't have enough CO2. If I don't have enough CO2 and I need more, I get that from the tissues in the body. I need my blood to sit in the tissues of the body for a little bit longer than it's doing. So by increasing parasympathetic, my mouse is not popping up when I'm trying to use it. It's driving me kind of crazy. I'm sorry. Okay, when I increase my parasympathetic stimulation, my heart rate and stroke volume are going to decrease. That decreases my cardiac output, meaning my blood is going to sit in my body a little bit longer. That decreases my blood pressure. It decreases my blood flow. That means that I'm basically going to pick up more CO2 while that blood is sitting in the body tissues, which gets my blood pH back into the normal range. Now, let's go opposite. Instead, it starts going lower, meaning that it's getting acidic, okay? So my blood pH decreases. Now, this often happens when I have too much carbon dioxide and not enough oxygen, okay? So I'm having issues because I don't have enough oxygen. So the chemoreceptor reflex in this case, is going to actually stimulate the cardioregulatory center to decrease parasympathetic and increase sympathetic. In other words, I've got too much CO2 and I don't have enough oxygen. I need to get this blood out of the body so it's not picking up excess CO2, and I need to get it to the lungs so that it can pick up oxygen. So, by increasing sympathetic, I'm going to increase my heart rate and increase my stroke volume, which increases my cardiac output. What that ultimately means is I'm going to increase the blood flow. Blood flow is going to go to the lungs faster. It's not going to sit in the body tissues as long, picking up tons of CO2. And getting to the lungs faster also means I can get rid of that CO2 faster. These two things increase my blood's pH, get it back into that window, and increase the amount of oxygen that I have in that blood. The effects of aging on the heart. Okay, I say this at the end of every chapter. Everything goes downhill as we age. Aging does result in gradual changes to the heart. They're mostly seen when somebody is exercising, though. There's some abnormal enlargement, also known as hypertrophy, of the left ventricle, but it's actually fairly common. I mean, your heart beats 24/7 your entire life, and you're talking about stretching something and squeezing it and stretching something. I mean, think of your chones. If you keep stretching them and letting them go and stretching them and letting them go and stretching them and letting them go, eventually the elastic kind of starts to wear. Your max heart rate may decrease over time. There may be an increase in abnormal valve function, maybe even arrhythmia where your heart doesn't necessarily keep the proper rhythm. You'll have increased oxygen consumption, basically required to pump the same amount of blood. It kind of makes age-related coronary artery disease more severe because you're doing that. Now, this is something that is actually kind of cool about the heart. If you stay active and if you exercise as you get older, it actually does improve the functional capacity of the heart. So if you are staying active, you will not see that downslide as much as somebody who lives a sedentary lifestyle. And that is the end of chapter 21.